Good afternoon. My name is Dr. Rohit Gajghate. I am Senior Resident Internal Medicine, currently working in Charak Hospital. Today we are going to talk about what exactly is edema. So what is edema? So basically in today's sessions we will discuss about edemas, its causes, symptoms, and certainly treatment options. So edema is the medical term of swelling. It occurs when the tiny blood vessels in the body will leak fluids when blood build up or is trapped in the surrounding tissues. So leading is into the swelling or whenever it is into the surrounding tissue, this is called as swelling or edema. It can affect any part of the body. One can notice it more in the hands, arms, feet, ankle, legs, or even in the face. So depending on swelling location, edema can be broken or can be actually of following types. So it could be peripheral edema, pulmonary edema, lymphedema, and so on. So what is peripheral edema? Peripheral edema, it usually affects the legs, feet, ankles, and hands. It could be sign of problems with the circulatory systems or kidneys. Fetal edema occurs when the body retains fluid in the feet and lower legs. It is more common in older one or pregnant women. Here, one can find it difficult to move around due to the numbness. So, this was fetal edema, and then move on to pulmonary edema. Now, what is pulmonary edema? It is the retention of fluids and air sacs in the lungs that makes it hard to breathe. And it's worse when you lie down. If you have a fast heartbeat, feel suffocated, cough up, foamy spittle, or sometimes with blood, then immediately call an ambulance. So what is lymphedema? Now, lymphedema is the swelling in the arms and legs that is usually caused by damage to the lymph nodes, which are the tissues that help filter germs and waste from the body. So this damage occurs due to cancer or its treatments like surgery and radiation. Now, cerebral edema. Cerebral edema, it is a very serious condition where the fluid builds up in the brain. It can be due to an injury to the head, a blood vessel that gets blocked or burst, or because of tumor or allergic reactions. Now, there is in the eye also, which is called as macular edema. So this is the when damaged blood vessels in the retina leaks fluid, which builds up in the part of the eye called a macula that is in the center of the retina. Now, this swelling or edema can be due to multiple causes, of which the most common cause is medication, pregnancy, or due to an underlying cause like congestive heart failures, kidney disease, or cirrhotic liver. Now, let's discuss some other causes of edema. Well, mild cases of edema can be due to sitting or staying in one position for too long, eating too much salty food, having premenstrual sign and symptoms, being pregnant. Edema can also be side effect of some medications like high blood pressure medications, painkillers, steroids, and estrogens, or certainly diabetic medications. So apart from this, edema can be sign or symptoms of serious underlying condition, medical conditions. So it could be, I can list up some very serious and some important medical conditions, including congestive heart failures, liver disease, kidney disease, or weakness of damage to veins or blood vessels, lymphatic systems where the excess of fluid from tissues is damaged, and severe long-term protein deficiency can also lead to inflammation of edema. Now, allergic reaction, severe inflammations, burns, trauma, clot, poor nutrition. These are certainly some serious underlying medical condition, uh, including the causes of edema. So interestingly, edema might be helpful in some cases as more fluid from the blood vessels gather more infection, fighting white blood cells in the swollen area. Coming to the symptoms, the symptoms of edema will depend on the amount of swelling you have and where you have it. Now, edema due to an infection or inflammation like a mosquito bite in a small area could cause no symptoms. While a large allergic reaction, such a bee sting, can also cause a swelling on the entire arm that cause pain and limit arms movement. On the other hand, food allergies and allergic reaction to medicine can lead to tongue or throat edema, which can be life-threatening and it interferes with your breathing. So what is and then furthermore, leg edema can make the feel legs heavy and can affect walking, while severe leg edema can interfere with blood flow, which can cause ulcers on the skin. There is also pitting edema, in which there may be indent or a kind of a pit that remains for a while after pressing the skin in some types of edema. But if the tissue springs back to its normal shape, called it is called as non-pitting. So now, furthermore, the signs that shows the presence of edemas are now, firstly, swelling or puffiness in certain areas where all over the body. Pressing onto the swollen areas leaves dimple in the skin. The skin covering these swollen areas appears fresh and shiny. Now, moreover, trouble while walking if you have edemas in the legs or feet, increased abdominal size, coughing, aching body parts, and stiff joints. Now let's see how edema can be managed or treated. Mild edema usually it's go away on its own, mostly by doing such things such as raising the affected area of limb higher than the heart, while more severe edema can be treated with drugs that help the body expel excess fluids in the form of urine. Now, long-term management involving treating the underlying cause or a disease also. For example, if the edema is due to allergy, one can take anti-allergy medications. Or if there is leg edema due to congestive heart failure or liver disease, that can be treated by diuretics called as a water pill. It increases urine production. As you know, water pill, it increases urine production, due to which fluids from the leg can flow back into the blood. If edema occurs due to medication, use your doctor might or adjust the prescription or check for the alternative medication. Apart from this, there are some home remedies can help reduce the swelling or prevent it from coming back. So first is moving the affected area. Moving and using the muscles of the swollen area can reduce the swelling, particularly in the legs. It may pump the excess fluid back towards the heart. Consult doctors about exercises one should perform to reduce the swelling. Try not to stand for long periods without moving, elevating the swollen part of the body above the level of the heart several times a day. One can try elevating the affected body part while sleeping. Gently massaging the swollen areas can help in moving the fluid away from the area of swelling. What exactly is the compression? Like how actually we can reduce it. So compression is wrapping the swollen areas using compression stockings, sleeves, or gloves. Reducing salt intakes as the consumption of your salt can lead to fluid retention in the body. Very important. Hence, worsening the condition of the area. So you should also ask your doctor to consult about how much salt can be taken or your salt intake to be adjusted. So protect the swollen areas by keeping them calm, clean, moisturized, and free from injury. As dry, cracked skin is more prone to scrapes, that's an infection. Now call doctor immediately if you have any pain, redness, or heat in the swollen areas, or have an open sore if experience shortness of breath or swelling of only one. So that's all on about the edema. So I hope everybody understood that what exactly are the causes, symptoms, and how it is being treated. So thank you so much. Thank you so much.